Hello, everyone, and welcome to Team TSI's training. Thank you so much for joining us today. We've got an exciting and another very resourceful training and resources available to you today. Before we get started, I want to make sure that you're able to download the resources and you're able to ask questions. So if everyone could just take a moment, look for your GoToWebinar panel. And if your GoToWebinar panel is collapsed, it will look like this little small bar in my very first screenshot. You want to click on the orange arrow, open it up so it looks like my number one screenshot. When you do that, look at those gray lines. Those are your options. And go to the questions and the handout. The questions panel, when you click on that, it will open up and look like number two, and that's where you'll type in your question. You'll hit send. It will be sent right over to us, and we'll be monitoring and answering your questions throughout the training and also saving some of your questions for the end. If you look again at your GoToWebinar panel, please find the handout line. And when you click on that handout line, it's going to have 5 different handouts. We will be addressing those handouts. One handout is simply the slides that you're looking at now. So you'll have a copy of everything we're going to be going through. And then we're going to have each handout addressed towards the end of today's training. So with that, I want to thank you again. We will really appreciate not only being your partner, but also being able to provide amazing resources during this time. And our hearts are with you. We really thank each and every one of you for everything that you're doing. And I'd now like to introduce your team. So we have a number of experts that really help us do our best for you. And first, I'd like to introduce our guest, and one of my favorite experts is Hugh Heaton. He's going to be going through some of the resources as he's prepared them towards the end of these slides. And also, my colleague, Greg Seipel, he's actually the Vice President of Informatics. He leads our team here and our experts in preparing all of this wonderful information for you. So I'm going to turn this over to Greg.
Okay. Thank you so much, Dahlia, and thanks for the very kind words. Thank you so much to everybody who's on the training today. We appreciate you taking the time away from your extraordinarily busy schedules and everything that you're dealing with in the front lines as we battle through this pandemic. And one of the things that we had, oops, it's not letting me advance. I thought if I got keyboard control, it would do that, Dahlia.
No problem.
Oh, there we go. I lost my train of thought. I apologize. Your name? Maybe I had to do that. Did that do it? Yes. Okay. My apologies. I didn't realize I had to click that other one. Oh, we learn as we go. So the time you're taking out for this, that in response to this, the CMS released a COVID-19 focused survey for nursing homes to kind of monitor for facilities infection control practices, the manner in which they're operating, and how that information would actually be utilized in the survey process and the expectation of each of the phases. Basically focusing in on an offsite survey activities, what's going to be accomplished back at the field office versus what's going to occur on site and who might be coming in for those on-site survey activities, what you can expect to see if you are selected for one of these COVID-19 focused survey processes. So we're going to go over the entrance conference worksheet as well, what they'll present to you, a very kind of a truncated version of what you're used to seeing on the entrance conference, but specifically geared towards this focus survey that they're pointing at to. And of course, the focus survey tool, which is part of that, is the self-assessment that the facility should do as well in order to prepare for all of this. So Hugh Heaton, as if you were on our prior trainings as well, who had done the hand hygiene and the personal protective equipment, the PPE, in servicing and training, widely recognized as quite the expert in pulling together these publications and pulling information from the system and putting it in a format that makes it very simple and easy to use. We're going to do kind of a broad overview of what the process is, and then Hugh's going to take you through the materials that he's actually developed that kind of walk you through even training of your own staff and everything you need to do from that standpoint. So first thing is that's the resources and handouts, of course, that we will review as well. So when you're looking at the offsite survey activities, if you have an active COVID-19 case, if the survey team has selected your facility, and then we'll talk a little bit about how you may be selected for this, but if the survey team has selected you, they will contact the state agency and the state health department to coordinate those survey activities. Part of this offsite survey activity is before a surveyor is going to enter your facility, they have to be medically cleared, and they have to have personal protective equipment that can be required on site. So the expectation that a surveyor is coming in unprotected certainly wouldn't be there, but they certainly don't want them to bring the virus in from the outside either. So the protection works both ways. Some of the offsite prep includes review of facility reported information. Some of that information could be related to if you have infection control oversight practices. There's some states that require notification to the Department of Health regarding certain infections that are occurring. Some states do not have that. The other thing that may be a factor in your facility reported information is prior citations for infection control, even at severe level. So if your facility has a historical performance of being cited under infection control, we're not saying it will, but it might put you at a greater risk of being selected for one of these focus surveys. They're going to review the CDC, state, and local public health reports, and they're going to be focusing in on what your patient population is like, if you have any reported cases, if you have suspected cases. They'll look at available hospital information regarding residents transferred to the hospital, and of course admissions coming in. If you're accepting patients who are positive for COVID-19, again, they may be very interested in observing your infection control practices. And then the fun one, the complaint allegations. And always remember that this is a very difficult time, and you guys are living it every day and dealing with family members and the restrictions on visitations. And there's a plethora of very unhappy families in response to this, and completely understand their concerns, but sometimes that coping mechanism comes out in different ways, and you may suddenly receive complaint allegations based on visitation rights or their perception of infection control practices in your center. And that's, of course, always a challenge, for everything else. So that's part of the offsite survey prep. Additional offsite survey prep is they will look at activities that can be conducted off-site, things that do not require an on-site review or being in the building. So the information you're going to look at is medical record review. They're going to be looking at the electronic medical record, and if they cannot get access to the electronic medical record for off-site, they will make medical record requests for information either to be copied or submitted to them to be able to conduct the off-site review. They'll look for interviews that can be conducted via telephone, and it could be family members, it could be staff on different shifts and off shifts that they will conduct phone interviews for. This will not be done in the facility. This is just off-site activities that a different set of surveyors will be focused on. Your surveillance policies, your policies and procedures related to infection control, prevention and control. It's the surveillance policies all can be reviewed off-site. They'll ask for a copy of that to be provided. First onset of symptoms, they'll ask for information, and this doesn't need to be, again, reviewed on site. They'll ask for whether or not we had a good methodology in place for identifying that, or what type of controls or surveillance do you have in response to that as well. How you're communicating information to staff, visitors, and health officials, because one of the things to remember in this survey process, this focused process, is anybody in your building that is assisting or providing support to your facility is eligible to be reviewed in their infection control practices while we're there. That's staff, that's contract employees, volunteers, consultants, anybody that's coming in from that standpoint is going to be open to review, and if something's found to be inappropriate, open to citation. And of course, to look at your infection prevention control programs, policies and procedures, again, all off-site. And they'll look at your emergency preparedness plan, including emergency staffing. All of this has existed for quite some time, and infection control has been a major or an increased focus for the Department of Health for a while, as we've seen with the infection preventionists and the changes in the regulations. The emergency staffing portion has always been there, but it's thinking beyond some of those things, that it's not just about whether or not your staff is getting sick, or if they've been exposed, or if they're infected. You have to think of the other contingencies that come along with something like closing of the schools. When the schools were closed down, every nurse that had school-aged children was at risk for childcare, or someone that may be primary caregiver for an adult, dependent adult. So, again, looking at those different contingencies, it might be transportation, it might be, public transportation if somebody utilizes that and there's been a shutdown related to that. So think of all of that for your emergency staffing plan as well. So what's going to happen when they come into your building? All the fun things that we're accustomed to happening when the Department of Health shows up in your building. But the on-site team will be limited to 1 or 2 surveyors. They're trying to limit exposure as much as possible during this focus survey. What you will see is the underlying thread in the survey is it's based on observations. It's observation, and interview is exclusive to the on-site survey activities. They can look at all of the policies and procedures and medical record information off-site. They want to observe practices. So they'll look at resident care observations, and they're going to try to determine from those observations if they're following appropriate hand hygiene practices, if they're utilizing and discarding personal protective equipment in accordance with guidelines. The protocols for proper cleaning and sanitizing of medical equipment. Again, especially glucometers. Glucometers have always been one of those touch points, or the bedside PTI&R machines like the Roche CoaguCheck. Those are properly cleaned and sanitized between uses, even outside of a pandemic. We've seen immediate jeopardy citations come from inappropriate following the standards for that as well. And I'll look at your transmission-based precautions. Whoops. I went a little bit quickly on that one. I apologize for that. So again, they're going to be doing observations of resident care. They are watching how you're interacting. They're going to be watching the utilization of personal protective equipment, all observation-based. We were sort of discussing prior to this training session starting how, the information in your policies and procedures, your survey manual, your emergency preparedness is all, documented. And even the medical record, there's very little you can do about what's already committed to pen to paper, let's say. The observation is what you have the best opportunity to impact, because if we're going out and doing those observations, we've been coaching the staff. There's a certain nervousness that will come along with the Department of Health being in your building. It's to be expected. But again, it's the on-site survey activities and those observational findings that create the greatest risk. That's where immediate jeopardies are going to be found. The environmental observations, they're going to look for signage. Is it posted at the entrance? Is it posted in the resident rooms? How are we screening staff? At shift change, entrances, limiting non-essential staff as much as possible. A lot of facilities are doing temperature checks at the beginning and the end of the shift on staff coming in. There's some screening tools out there that you can utilize to monitor your staff if they've had an exposure from a symptomology standpoint. But how we're screening the staff in the building to ensure that we're mitigating that risk as much as possible. Where's the location of hand hygiene stations? Some people have wall-mounted alcohol hand sanitizer gel dispensers? Is it easily accessible to anybody in the facility? And again, not just staff, visitors, contract workers, anybody, volunteers, anybody that's coming in and assisting in the building. The survey team is going to conduct interviews. Now, one of the things before we jump into the interviews we were talking about in the environmental observations as well is a lot of times there's an oversight or a missed opportunity in looking at the technology that we're using. We all know phones are very primary sources of infection material, but also the kiosks in the hallway that are being used to document if you have electronic care tracker or POC. How often are those being cleaned and sanitized? Computer keyboards, iPads, phones, cell phones, personal phones. Those types of things are pretty widely known to be sources of contamination, but they're often overlooked in looking at most of the medical equipment that we have in the building as opposed to electronic or tech. So the survey teams can interview staff as well. They want to know their knowledge of your infection control practices, your policies and procedures. Are they able to answer questions appropriately on utilization of personal protective equipment or hand hygiene? They'll look for surveillance protocols for identifying signs and symptoms. And again, this is based on interview, how well they're answering those questions. And looking at protocols for notifying local health officials of infections as well. Are you following your state-specific guidelines or your facility-specific policies and procedures? So there's a lot to take in there. That obvious on-site activity, the resident observation, the environmental observation, the interviews of the staff, they're all have potential. And then never forget that anytime a surveyor is in the building, they will also look for additional potential risks. Now, despite this being a focused survey, you'll see in the materials that they are still giving guidance to the surveyors to look for other areas that may meet the level of immediate jeopardy. So on the entrance conference worksheet, when they come in, there's a couple of things on that. They will do a very brief entrance conference when they arrive at the facility, inform the administrator of the limited nature of the COVID-focused survey. There's a modified entrance worksheet that they will provide to the administrator, and with the exception of what is requested immediately upon the survey team entrance, which is going to be your census number, an alphabetical listing of residents and rooms, a listing of residents who are confirmed or presumptive positive for COVID-19 or being monitored, and the name of the facility staff responsible for the infection prevention and control program. Your infection surveillance officer, your infection preventionist. Everything else, despite it saying immediately, and here's what's needed within 1 hour, everything else on that page is expected to be delivered within 1 hour. However, in the guidance and the training to the surveyors, they do allow for, depending on the severity of what's happening in the building, a little additional time before this stuff could be provided. But there is the entrance conference worksheet basically specifies 1 hour for all of the additional information, the rest of the information to be provided. And that's going to include your working schedules for your licensed and registered staff for the survey time period. Again, it should only be a 1 to 2 day survey. A list of key personnel, their location, their phone numbers, any contract staff that you're utilizing, rehab services, agency staff, and they'll want to look to see what type of training, observation, competency may have been completed on them as well. How to access the resident electronic health records. If you're utilizing an electronic medical record, depending on which platform that you're utilizing, there's usually the ability to grant a remote access for a user. Be very cautious of setting an end date for that access to expire. If we don't set an end date for that, it's going to basically leave it open for that person at any point in time while off-site to be able to review information for your facility. A lot of electronic medical records, the software packages allow you to create a role designed for surveyors to look at specific information relevant to their job, but not necessarily to look at all the reports and information that's inside that. So ensuring that you've got a role set up for the surveyors that doesn't grant them a free access to the entire electronic record for your building. If you can access remotely the EHR, they will request that access information, and if they can't, they're going to make copies or request copies of whatever information they need to take back for the offsite review. They'll ask for the name and contact information for IT and backup IT questions. And lastly, they're going to ask for specific policy and procedures. And again, within 1 hour of the survey entrance, but again, it's all within 1 hour of the survey entrance as designed by the entrance conference worksheet. They're going to look for your infection prevention and control program, your policies and procedures, including your surveillance plan. And they're looking for compliance with F880. Your emergency preparedness policy and procedures, including staffing strategies for emergency situations. That's an emergency preparedness tag, and also policies and procedures for volunteers as well. And the offsite review, if this is what we were kind of touching on a couple of times, if the offsite review of the EHR isn't possible, they're going to request photocopies of the medical records, which again places an undue burden on the facility staff. They will also try to make those copies or printouts themselves if able to as well. But they really are focused on the on-site to be observation and interview. They're really focusing on what they're seeing in the practices happening in the center. The COVID survey tool, that was released in the QSO letter from the 20-20, if I remember Hugh priming me for that right before this call. again, is looking at some, it's basically a critical element pathway that's looking at the elements focusing on the transmission of COVID-19. Always remember, standard and transmission-based precautions that they are looking, I think it's going to say at the end of the slide, my apologies. Quality of resident care practices, including the COVID-19. It's paints a broad picture, your policies and procedures, your infection surveillance plan. This is all that staff worksheet that allows you to prepare for this type of a survey coming, and they're going to be using the same information to evaluate your facility. The visitor entry and facility screening practices are broken out in there as well. Your education, your monitoring, your screening practices of staff as well. Staffing issues and emergencies that we've spoken about as well. And then the sort of the fun one, that while this is a COVID-19 focused survey, there is instruction for the surveyors to investigate any other areas of potential noncompliance if there's a likelihood of IJ. Now, the difficult part in all of this, in these certain variance between surveyor practice, is there are certain surveyors that will focus primarily on the intent of the COVID-19 focused survey to look at your infection control practices. There are surveyors that will take whatever opportunity to dig into other areas that they can. It varies by surveyor, by type, by personality. It's just sort of the nature of human behavior. But you would like to believe they are going to stay focused purely on the infection control practices, the reason that brought them in. However, if they are seeing another situation that could result in immediate jeopardy, and never discount associated tags. And as Hugh, I'm sure will tell you as well, a lot of associated tags that come along with immediate jeopardy could go to administration, could go to policy and procedure, could go to facility assessment, competencies of staff. You can wind up with a sort of compounded stack of citations in response to this if you're not well prepared. So having said that, I'm going to turn the presentation over to Hugh Heaton at this point. And again, if you're familiar with the Heaton manuals, the quality of work that has come out of this man for years, it's staggering, it's awe-inspiring. He has taken this process and created a packet that will allow you to not only train your own staff, but be well prepared and clearly understand this process and how it can affect you. And he's giving you all of the information you need to be successful. So having said that, Hugh, the floor is yours.
Thank you, Greg. That was a great presentation. I know it was a high-level overview, but it was extremely good. Thank you for allowing me to be a part of this. I want to quickly go through your support resources that we've provided for you. I think that will give you the tools that you can use for your management team to take and get an in-depth review of what Greg has just discussed. The first handout is handout number 1. It is a survey process. It's a compilation of all of the resources that the surveyors will use. One of the things that I found when I was doing some research on the focus survey was this information. These are the actual surveyor slides that have been used by CMS to train the surveyors. When I found them, I couldn't believe that they were available. I don't know if they're still available or not, but we have them. So what we have taken with the slides is that we have where they discuss information to the surveyor in their presentation notes. We identified where this information is, and then we have put it in one document. So as you're going through the training slides, you're going to see blue text, which means Greg talked about a memo 2020. Well, as you're going through the training program or going through this survey management tool, you can click that and it will take you directly to that particular document. But I want to go through the entire document so you can see that everything that's here. The next document that we put on is the focus survey protocol. The slides talk about this. These are the protocols that the surveyors are to use to prepare prior to the survey, the entrance conference, the on-site, things that Greg went over. This is a detailed review of the focus survey protocol. So all of that information is there. This is the entrance conference worksheet. It's a modified worksheet. It's 2 pages. Talked about the entrance conference, everything that needs to be within 1 hour. Then it has, on page 2, it has where they're looking for specific information in the medical record. They're looking for 5 things: infections, hospitalization, change of condition, medication, and diagnosis. They want to know where in the medical record these 5 things are located. Next is the survey tool. This information came out of 2020, QSO letter 2020. There was some confusion about, is this a pathway? Is it a survey tool? Is it an assessment tool? So I sent a text to CMS. They did respond. Is this the survey tool that they were talking about that they're going to use when they come into the facility to survey the facility? And their response was, yes, this is the survey tool. So everything that Greg discussed is in the survey tool. It's a 7-page document. We also have 3 of the latest QSO letters that deal with COVID-19 and infection control survey. 2020, 2017, which deals with the respirators, and 2014, which provides more information about revised guidance, especially to visitors. So all of that is in one document. It also talked about looking at, when they're looking at the emergency preparedness, is they're focusing on this policy, on these regulations, policies and procedures for volunteers. So how are you training the volunteers? How are you using the volunteers in emergency situations? So that's the focus tag, and you will see that in the survey training slides that they focus on this particular tag. We also provided the F880 survey regulations and guidelines. And by the way, all of these are bookmarked. So if you're looking for information on the surveillance regulations, everything is bookmarked. You'll be able to get to it very quickly. It also contains the optimization supplies, because that information is discussed in the surveyor's training slide. So we added it to this document, even though you do have it in your other documents, in the PPE documents, you have that as well. Then the last thing that in the survey management tool is this letter from CMS, and this contains the latest information about survey guidance. Throughout the slides, you will be referred to specific paragraphs in this letter. And so if you've not looked at this letter, you may want to take a look at it, because it describes, Greg mentioned the observation process for hand hygiene and personal protective equipment. CMS released some information last week on the results of the first week of focus surveys. 36% of the facilities were not following hand hygiene and hand washing practices. 25% failed to demonstrate competency in using personal protective equipment. So that was the results of the first week of the focus survey. So you may want to look at that. CMS is aware that there are shortages. They're not going to cite the facility for shortages or reusing personal protective equipment if they're following the OSHA and CDC guidelines, and if they have information about good faith efforts to purchase it and it hasn't been delivered. So they're going to be very lenient. Before the facility can be cited for shortage of PPE supplies, the survey team is instructed to contact the regional office before they issue any type of citation on that. So that's good. So this particular document is 100 pages. It's formatted that you can print it on two-sided. I printed my copy out. I've used it throughout putting all of this training material together. I want to show you handout number 2. It is a Excel spreadsheet. It's discussed in the training material. This is a CDC Excel spreadsheet that provides information on how much personal protective equipment you are using. Surveyors have been instructed to ask for this, even though it is not mandated. You are not required to use this, but it does provide what they want you to do is enter the number of boxes of personal protective supplies that you have, and then it tracks it for a 14-day period. And over here, I'll show you this. It will give you a burn rate. How many supplies are you using over a period of time, so that you will know how much do I need. In some of the CDC and CMS material, they are referencing that. That is part of your handout material. So you may want to download that. You don't have to put any formulas in it. All you have to do is put the information in. All the formulas have been pre-entered. It will automatically calculate your burn rate. The next I want to look at is handout number 4. These are CDC's current guidelines for allowing staff to come back to work or to use people who have been confirmed or suspected COVID. These are interim guidelines. CDC and CMS does reference this document, so we located it and added it. But I want to focus on handout number 3. The slides that Greg went through were just a high-level overview. The slides that we've provided in your handouts, this is an in-depth overview or an in-depth review of the focus survey process. Everything, that we've discussed throughout the program is discussed in these training slides. Provides where the information came from, what handouts you can use, instructor notes. It even gives you the information I just mentioned about the 36% did not follow proper hand washing and 25% failed to demonstrate proper use of PPE. But as you go through the training slides, for example, when it gets to offsite preparation, it will provide you, and then in the instructor notes, what page number to go back to this document, exactly where to go on this document to find the information. They are used hand in hand. Now, this document is linked. Every document that you want to get to in this document is linked. The training slides in handout number 3 is not linked to this document. The reason being is the document would be so large it would be almost impossible to use. But you can print this document out, or if you open both documents on your computer, you can do that. But you're going to find that this is a very detailed overview of the survey process. It discusses everything about the survey process, including how they're going to use the survey tool. It goes right through. It tells you which page number on the survey tool that you need to be looking at when you're looking at hand hygiene. It's the exact same information that's on the survey tool. So you will find all of this links back and forth. Even if you don't have the time to train all your management staff, if they will just take the time to read the slides and the notes, they will have a tremendous understanding of the survey process. So these handouts are really very detailed, and you will be able to train your staff exactly on what's needed to be trained very easily. We hope you use them, provide them to your staff, and share them with others as you deem necessary. That's all I wanted to do, is go through the training slides. Thank you for all the work that you do, putting your staff and your family and yourself in harm's way. I can't imagine the stress that you go through, but thank you for that. Thank you for wanting to learn and how to do this without the survey team coming in and being difficult to work with, and sometimes they are. So, Dahlia, I turn it back to you or Greg for any questions that they may have.
Yes, we do have a couple questions. Thank you so much, Hugh and Greg. That was awesome. I think I'm already getting some feedback on how important this is for everyone and the help and resources you're providing. We're all so grateful for this. A couple of the questions we're going to cover right now. So please go ahead and feel free to type your questions in that question box. But the other thing I may have missed in the beginning is the handouts are available to you on the GoToWebinar panel. Everything that Hugh and Greg were referring to, including the slides that we used for the presentation today, they are in your handouts. If for some reason you're not able to download those, we are happy to send them over to you. We can also send you the recording of today's training. Our support team, your senior account managers, everyone is ready to send these over. So just reach out and let us know, and we'll be following up by sending those. The two questions we have, Hugh and Greg, regarding the list of COVID positives and presumptive cases in the list to be provided only current residents in the facility at the time the survey starts, or will they be looking at historical information?
It's a great question. If you think of the regular survey process, whatever the census is when the surveyors walk in the front door is generally the residents that are open for review. New admissions or residents that are out to the hospital aren't. Having said that, the information they're requesting is your current census and any active or suspected COVID-19 infections you may have in the building. If, however, the nature of the survey, why you were selected for the focus survey, is dependent on something like a complaint from a prior resident, they will certainly look at historical information in the closed record review. So you can't really say it's just going to be limited to who's currently in your building when they walk in the door. It sort of depends on what the nature of the focus survey, what drove that focus survey to your door.
Yeah, I think that's
Wonderful. Thank you.
True, Greg. One of the things that caught my attention. I'm sorry.
No, please go. This is perfect. Thank you, Hugh.
One of the things that caught my attention in the listing is that they wanted the date of the first COVID-19 positive case. My thinking on that was they're going to look at that to see how the facility implemented its infection control program to prevent any further cases, and how they did that, and how did they reduce the transmission. I agree with Greg. The process did not address the listing, who would be on the listing, but it appears to me that it's talking about just those residents in the current census. That doesn't mean that they won't everybody. We don't know that for sure, but that's a great question.
Yeah,
I'll try to research that.
Yeah, that is a great question. And, they're going to look at surveillance records as well, and your infection control tracking as part of your infection control program. So, there's still going to be historical information that can be reviewed based on that alone. But we'll see if we can get any more information on that. Thank you.
Here's another really great question for the both of you. Could you please provide more information of emergency staffing? Examples of what should be prepared for employees without childcare, adult care, and so on. So if you guys could expand on that, that'd be wonderful.
Yeah, that's a very difficult, loaded question because, a lot of, I know of locally where I live, a number of facilities that, when we started to look at these social shutdowns of businesses and then the schools, they were already anticipating that the schools were going to be closed and what that impact was going to be on the staffing situation for any nurse or any staff member with school age children. What they had asked those staff members to do was to come up with a plan. Is there someone who could watch? Do you have a mother or a relative or somebody that could assist with that support during working hours? I am aware of a couple of places that are supporting or supplementing daycare costs for nurses as well. That's an option as well. And I know of a couple other places that are doing on-site childcare, which is a little bit more fraught with danger, especially considering the nature of the infection, and it doesn't really adhere to the social distancing standards. But we're trying to ensure that nurses can still come to work and care for this at-risk and needy population that we have. So I wish there's really not a singular answer to that. It's a very difficult and challenging, and trying to work through all the different permutations of what that could mean for your building is tough. My heart goes out to everybody that's struggling with it.
That is extremely a tough question. One of the things that I believe that they will look at as part of the emergency preparedness plan is what is my emergency community, not necessarily the surrounding population, but my emergency community is my EMA, my fire department, my churches, my schools, all of those coming together to help resolve the issue that you're talking about. How do they all work together to do that? That's part of the emergency preparedness plan. Every community is different. I wish there was a one size fits all, but there is not. As long as you're attempting to meet those needs, I don't see a citation. But that's just me. I guess it depends on who your surveyor is.
Very true.
Hard question.
Thank you both. Yes, that was great. Thank you. Another great question we have is, if you don't have a positive COVID-19 case, will the surveyors come to just do an infection control survey?
I'll give that one to you. Yeah.
If you look at it, it doesn't mean that they will, but if you look at in handout number 1, the COVID focus survey protocol, it has the survey protocol will be used in the following ways: facilities with COVID-19 and facilities without COVID-19. So it can be used for both of them. If it's used for one, and I am thrilled that you don't have a COVID positive, that is great. Means you're doing something really well. The use of the survey protocol and focus review tool will help identify and correct deficient practices in order to prevent. So those without, they're going to look at how you prevented it. So yes, it can be used for both.
Wonderful. Thank you. Well, it looks like we have answered all your questions. We're so grateful that you've given us your time today, and we hope that this was helpful. Again, thank you so much to Hugh and Greg and all of our experts at Team TSI that are continuing to want to provide these resources for you. So your positive feedback keeps us wanting to continue this. So please look out for one specialized training like this in the next few weeks. We're already kind of one step ahead of of the next couple weeks, and I'm really excited to tell you we've got something special from Pat Newberry coming up in a couple weeks. So we'll be sending the proper publications for you. You can find it in the training portal, but all of our experts are really busy wanting to continuously provide these awesome resources. So if there's anything else we can do for all of you, please let us know. And thank you again for being our friends and partners. And again, we're all here for you. So thanks you. Thank you, Greg. Thanks, everybody. That concludes our webinar.
Thank you.